Hi everyone, my name is Dr. Vikram Jayaprakash and welcome back to the Hair Loss Show. In today's episode we're going to talk about how you would approach switching from a topical minoxidil to an oral minoxidil. So stick around.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hey everyone, thanks again for watching, and please remember to like and subscribe to the channel. So let's talk about how one would switch from a topical minoxidil to an oral minoxidil. I think first of all, we've got to understand that minoxidil, how it works is a stimulator. It stimulates hair growth, and it can be used topically or it can be prescribed orally. And topical minoxidil is freely available, and certainly here in Australia it's available over the counter, Regain, Rogaine, and you can buy that, and it does not require a prescription. Oral minoxidil, on the other hand, does require a prescription because it was formulated initially for something else. It was formulated as an antihypertensive medication. So not everyone that is on topical minoxidil is a candidate for oral minoxidil, and it's something that you should speak to your prescribing physician. Make sure that you get your hair loss assessed by someone who knows what they're talking about, who can weigh up the pros and cons for oral versus topical, because there are pros and cons to both sides. But let's just say you are on the topical and you want to switch to the oral. Well, what are the factors that will influence that decision? Well, one factor that may direct you in the direction of wanting to change is if you feel that the topical minoxidil is not as effective. And that can be because absorption is not great in any one particular individual. Sometimes people have very thick scalps, and therefore the penetration of the medication through the skin is not significant. Another reason is maybe there is a large area that requires treating, and therefore the concentration that you're able to apply to the scalp is not sufficient, that you've got a good enough concentration gradient for it to get through. And certainly if you've got a large area that you're trying to treat, it would take a lot of the topical lotion or liquid, I beg your pardon, or the foam to cover that area, and which may be, result in it being quite expensive. In that scenario, you may consider, all right, let's switch to a oral format, and you've got to make sure that you're a candidate for oral medication. If you've got any history of cardiac abnormalities, cardiac problems, high blood pressure issues, low blood pressure issues, then that's something that you want to talk through your prescribing physician with. But the short answer in how you would switch logistically from a topical to an oral, well, it's very simple. You stop one and you start the other. There's no long-term phase in, phase out that is required. Are there going to be any issues with shedding that you're going to experience it when you're switching between one formulation to another? And I think generally the answer to that is no. If you've been on topical minoxidil for a prolonged period of time, obviously you can, and we've spoken about this in the past, you can get shedding when you start on minoxidil. If you've been through that, you're stable, and everything's going well, switching to an oral format does not result in a greater deal of shedding at that point. So I think as long as it's appropriate, and again, I would advise you to make sure that you get this checked and and speak to your physician about it, then the conversion is relatively easy. Certainly the change from one formulation to another is very simple and straightforward. So I hope that's brought some clarity to that question. Thanks again for watching. Hope that answers that question, and we'll see you again on the next episode. Take care.